Overpriced hospitalization, crowded hospitals. These are the factors that affect our society during this pandemic, which is why we created a system that will help neutralize this effect on our Filipino people and all the society. This is the Android-based healthcare management system. Nowadays, people are scared going outside due to the pandemic, and most of them is people who need medical attention. Most of them need to be checked by a personal doctor, which is why the researchers came up with the idea to help them not to go outside anymore, so that they would be safe in their own houses and would not be exposed outside. The proposed system also benefits those people who lives long way to the hospital but do have internet connection. With the proposed system, it may help them to be diagnosed by a professional doctor even though they are far away within the hospital. Also, if they have elderly people who are more vulnerable to the pandemic, will be safe at home and will be checked by professional doctors and will get proper medication. The healthcare problems are growing rapidly day by day, and people have to spend a lot of money for their daily checkup because of lack of salary to provide their daily checkup. Android-based application aims for an easy access and use for providing almost low of cost to users. Therefore, the development of healthcare Android-based application is gives certainty of providing health services which can improve their health. The application was developed Android operating system environment. Specific objective. The specific objective of the system is to design an efficient web-based system for the advancement of medical research and analysis, which will make it easy to follow up patient medical records from any workstation in the hospital. Will though replace the method of one point of entry retrieval that exists in non-web-based system. The work will also help in speeding the processing and storing and retrieval of the information, which will greatly assist medical personnel in performing their duties. It will also help to improve decision making by reducing process time as well as reducing the communication gap between the doctor and the other staff that are involved in the patient's medical care. It will also help reduce human errors and barriers minimum in improving computation. Background of the study. Implementing a new technology and digitizing clinical and patient information are only parts of the process. Creating a healthcare management system. Many providers decide to seek outside assistance to help ensure a seamless transition to a healthcare management system. For example, they turn to a project staffing service that can provide consultants with healthcare management and business system expertise. Medical professionals who will be using the system every day, like doctors, nurse, technician, and medical receptionists, and many others, need to be engaged early in the process so that they have a say in how the system is designed, receive appropriate training, and have a simple time to prepare for what will be a monumental shift on how they work. Statement of the problem. During this pandemic, many people are having a hard time bringing their loved ones to the hospital who have illnesses. Due to the pandemic spread, it is hard to determine who are infected by the virus, and collecting data is kind of hard due to the pandemic. Main problem is finance, the high cost materials for the project, and everyday constraint, increase in transportation tax during data collection affected the research work. The data collection also work had problem in collecting data from patients' record. Materials constraints play a major role in that limiting some research that would have contributed immensely. Specific problem: lack of instantaneous recoupment, lack of instantaneous data storage, lack of reminding updates, and error-prone manual calculation. Objective of the study: the main objective of the proposed system is to ensure and give end users a health management application that is reliable when they need a proper health assessment and health monitoring when it comes to a daily basis. The proposed system will ensure proper health assessment and proper treatment with the help of different medical professionals who will help clients assess as they were in the hospitals when they are having their regular checkup. The system will ensure confidentiality within the developer and the end user. Specific objective: the objective of this project work is to design an efficient web-based system for the advancement of medical research and analysis, which will make it easy to follow up patients' medical record from any workstation in the hospital. This will though replace the method of one point of entry retrieval that exists in non-web-based system. The work will also help in speeding up the processing, storing, and retrieval of information, which will greatly assist medical personnel in performing their duties. It will also improve decision making by reducing process time as well as reducing of communication gap between the doctor and staff still involved in the patient's medical care. It will also help reduce human error to the barest minimum and improving confidentiality of the file. System features: software requirement. These are the requirements so that you can use the system smoothly.
Ito po yung ginawa namin na system, yung research project. So, para makapag-login po kayo sa aming system, you have to put your email and then put your password. Tapos po, pag-login, then pag gusto nyo naman po na mag-register at wala pa kayong account, you have to click this register. Input your name. For example, Disiree Dela Cruz. And then your email. And then your number. And you have to create your password. And then, click OK. So, sa diet types po, meron po tayong iba't ibang klase ng diet. Una po is yung paleo diet, blood type diet, vegan diet, South Beach diet, Mediterranean diet, and yung raw food diet. Click go back. And then dito naman po sa wellness form is you have to fill this form. Yung current weight po, the current height, the body mass index, the goal weight, the type of diet, and the hereditary illness. Click check, submit. Okay. And the consultation This is the content of our consultation. And the prescription. That's it po. Yun lamang po ang aming content ng system.